record on this computer. Recording. Okay, we're recording. Thank you, Jaslim, and I'll let you introduce yourself.
Yeah, so my name is Jaslim. I'm part of the BA MS Combined Psychology Community Program, and I am currently in Dr. Glandsmith's class and doing her fieldwork class, and she asked us to do an interview assignment as a part of the class, and she always talks greatly about you. So I thought, what a better chance to get to meet you.
Well, delighted to help out, and thank you for allowing us to tape this so we can share it with possibly others who might like to hear about our conversation.
Yeah, of course. Thank you. So I guess if you wanted to go ahead and introduce yourself.
Sure. My name is Lenny Jason, and I'm a faculty member at DePaul, and I've been here, if you can believe, this is my 48th year, so a long time. And I helped develop the community concentration, as well as the 5-year program of kind of a master's, as well as the clinical community program and the community PhD program. So I had involvements in all those programs, as well as I was the one who helped start up the human services concentration many years ago. So I'm delighted to see our programs in the community area doing so well.
Yeah, thank you. Yeah. So I guess how would you define community psychology?
So I think I've always kind of felt community psychology is really trying to kind of think about more of a public health approach. In the simplest terms, it's the difference between a doctor who sees patients and a public health person who kind of is thinking more about how do we prevent problems from occurring? How do we, in some ways, get to the root of the problem? Think about changing the environment and people's environments, and how people interact with those environments and how environments interact with them, whether it's social processes or other types of issues. So as a community psychologist, we're always thinking about how do we help people with both mental and physical health issues, but doing it in a slightly different way, a way that's kind of in some ways maybe dealing with epidemiology, which has to do with estimating the prevalence of an illness, thinking about how to reduce stigma, thinking about how do we, in some ways, provide resources to people who don't have those resources. And these are new roles for psychologists, and they really involve us collaborating with many other disciplines. So we become, in some ways, the people who are boundary spanners between different arenas to try to bring about change. So yeah, I think that's really what it is. It's just as our introduction to community psych book talks about, as being an agent of change. And certainly one can do that in many different ways. But I think the community psychologist has kind of a training that gives them a unique opportunity. So we're kind of like a community organizer, except just very similar to the things that former President Obama was focusing on. The difference is, I think, we have methods to evaluate whether our interventions work, and I think we have kind of a conceptual and theoretical background that kind of points us in certain directions to bring about that change.
Yeah, no, I think that's great. I'm so happy to have found the community psych program here at DePaul. I guess part of the reason why we're doing this assignment is just also to kind of help us learn how kind of community psychologists got here. So I guess if you could just talk about maybe like how you got here, like your background and what like drew you to create these programs and community psychology.
Sure. I'm happy to provide my pathway, I was very interested in kind of politics and worked for a number of different campaigns when I was in either junior high school and high school. And those efforts seemed to not go too well. I worked with the Humphrey Johnson campaign and ended up, those folks got us into the Vietnam War. And I also kind of worked for a congressman when I was in high school, and he ended up getting indicted. And then I worked for the Bobby Kennedy campaign, late 1960s, and he ended up getting shot. So I think my conclusion was, maybe I should do something else career-wise. So I certainly thought psychology would be a good, because I really was fascinated by psychology. And I also had an experience when I was in a library at Brandeis University, and I went there to actually study with Abraham Maslow. And I was kind of my senior year trying to decide, do I apply to clinical psychology programs or maybe law school? And I took some kind of Supreme Court briefs out of the library and I started reading them, and I kind of fell asleep. I said, gee, that's not a good sign. Whereas the psychology stuff I was just fascinated by. So I said, I'll kind of stick with psychology. But at the time I graduated, 1971, there really wasn't community psychology really as a field known to people like myself, although the field had started a few years earlier. Most of my professors and the student body really wasn't aware of it. So I went to a straight clinical program, but just by chance, I happened to pick one where you had one of the founders of the field was there, Emery Cowan. And I heard him give a talk at the University of Rochester, where I went in 1971. And, he kind of said, they have paraprofessionals, people with BAs, who kind of have been compared with folks with PhDs in delivering clinical services. And really, people like Joe Durlak and others have not found a lot of significant differences. So, it could be the enthusiasm you have as a paraprofessional could be really one of the keys of helping people, maybe less so than the specific techniques you're using. So I said to myself, gee, I'm going to school for 4 years to kind of get a degree, and I might be as effective now. So that was a little bit kind of illuminating for me. And then he kind of said, the people who really get services really represent just the demand, and the need is much greater. And actually, we don't have enough mental health professionals to service all the people who really need it. And really, probably, we should be focusing not just on treatment, but on prevention. And when I heard all this, I said, boy, that's it. I am going to become a clinical community psychologist, whatever that meant at the time. But I said I will be someone who will be involved in thinking about training, thinking about working with community groups, thinking about prevention, thinking about large-scale interventions, thinking about different ways of delivering services than waiting passively for people to come to see me in an office as a traditional clinical psychologist. So that's my early roots into, so I was very fortunate, kind of lucky to actually end up at a program that was trying to kind of introduce this new field. So that was something that I think sometimes luck has a lot to do with kind of where we sometimes end up. So how about yourself? Tell me about your journey into this field, and how did you end up kind of saying this is the right one for you?
Yeah, of course. So I've always been interested in psychology from a very early age. I always would tell my mom when I was younger, 10, I want to be a psychologist. I probably didn't even know what that meant at the time, but yeah, I kind of just stuck. I think that's in my mind. I just felt like it was kind of like a doctor for the brain, like how I would look at it when I was like really young. But I guess as I did high school, I took a lot of like psych courses and I knew like this was always the kind of path I wanted to take. And so when I came to DePaul, I was more on track for psychiatry. And I realized that it wasn't as on hands as I would like to be. And that's when I started kind of going more into different like paths. And then that's when read about community psychology and I was kind of like, this is a no-brainer. Like this is definitely the path that I want to take. And I love the classes that I'm able to take now and kind of just like I love just the field work classes and just actually being there and being able to create change and things like that.
Great. Well, thank you for sharing that with me. And are you thinking of going on at some point for? Sounds like the program you're in is the BAMS program.
Yeah, so I'm in my fourth year, so I'm graduating from my undergraduate, and the next semester I'll be going into the fifth year of the MS program.
Great. Well, we're real excited about this program, and we think we already have a number of folks who have gone through it and seem to be having great opportunities to them. So we're really excited about it.
Yeah, I'm definitely really excited. Whenever I tell people that I'm in this program, they're like, "What is community psychology?" And I'm like, "Well, let me tell you." And they're always kind of shocked, like, "Well, why hasn't this been a thing? Like, why this is kind of like common sense that like why hasn't it been around for longer, you know?" But
Well, you're becoming an ambassador for community psychology, so
yeah.
that's wonderful.
Yeah, I guess if you kind of want to talk a little bit about like the programs that you currently have. I know that you have the Oxford houses and also the studies with chronic fatigueness, if you want to like talk a little bit more about that.
Sure. I am the director of the Center for Community Research, and we've been here over 20 years. And we have three areas that we work in. One is prevention, and that deals with work that I work on with Dr. Lavone Robinson, who works in high schools in the west and south side of Chicago and trying to deal with suicide prevention programming to sort of see if we can help some of these youth reduce kind of the harm that has taken place, um, you know, and to reduce violence and to reduce suicidal ideation. So that's one program that we're working on. I also work with recovery homes, and I work with a group called Oxford Houses, and I've been working with them for many decades. And they're self-run, self-governed, and there's over 3,000 of them. There's about 50 of them in Illinois. They're in every state, just about every city. And they're a place where people who often come from institutions, often jail, prison, or treatment settings for substance use disorders. And it's a place for them to just basically have a opportunity to stabilize. If you look at people coming out of jail and prison, of which most of them are there for substance use disorders, the two things that they try to ask for is a safe place to live and a job. And those are the two things we often don't provide those hundreds of thousands of people coming out of jails and prisons each year. So what recovery homes that are Oxford houses are an opportunity for people to learn, to live together. Everyone's working, everyone's kind of not taking alcohol or drugs, and everyone is not engaged in illegal behavior. So, it's kind of how do we change people, places, and things? And that's what these settings try to do. And they're very inexpensive because the people pay their own rent and there's no professional staff and they self-support themselves. So if you think about it, here we have 25 to 30,000 people today around the country living in these communities. And our group at DePaul is the primary ones that's been kind of evaluating them. So it's really the best sense of community building and trying to help people help themselves. It's a very nice self-help approach, but it's, when you sort of say we community psychologists should be dealing with housing, well, I don't have to do it myself. I can work with organizations that are creating housing opportunities for people that are in desperate need of a place to live that's safe. So that's one example. The other thing that I've been very interested in is kind of reducing stigma for marginalized populations. And one of the groups that's most stigmatized are those who have what's called ME/CFS. ME stands for myalgic encephalitis, and CFS for chronic fatigue syndrome. So ME/CFS is something that affects over 1 million people in this country. And those people are often treated not well by our healthcare system. And many times their complaints are marginalized or really not legitimized. And so the work that I do is to try to do real basic research to provide some credible data for people with this illness. And now we're working with long COVID, which is another viral infection of which, about 10% seem to not recover. And what are we going to do with those folks? How are we going to help them? So we do basic stuff like, for example, we develop validated questionnaires that can help people get a diagnosis. And we also do lots of advocacy type work, working with community groups and patients to try to make a difference in many different ways.
Yeah, well, all those are amazing. I think it's amazing how many Oxford houses there has been. I think that's really impressive. I guess my next question would be, what is your most favorite part about the work that you do, and what is the least favorite thing that you do?
Well, the most favorite thing that I do is really when I see and work with young people who are provided some initial opportunities that help them kind of take the next step in their professional career. So it's very satisfying. We've had over 250 people working at my center for the last 20 years who have gone on to graduate schools. And again, seeing how those people have done over time has been very gratifying. And even when I was a graduate student, I was working with undergraduates, and one of my undergraduates who worked on my dissertation ended up going to NIH and working there and became my program officer for one of my Oxford House grants. So it just kind of goes to show that I help someone and they help me back. And that's really the way kind of life often is. The least favorite piece is that, there's been a pandemic that has hit our university as well as society pretty hard. And, there's been job freezes at times at DePaul, and a lot of people left who deal with administrative issues, particularly on grants. So that's been tough to just deal with all the administrative changes and challenges and accounting issues that are necessary when one is dealing with kind of large grants. So our hope is that will soon stabilize and things will be a little bit better. But it has been a challenge to kind of run my grants for the last few years.
Yeah, I can't imagine. I mean, COVID definitely stole some of my college experiences, but we're just dealing with it. Um, but I guess what's something that you know now that you wished you knew when you first started the journey?
So I think the probably the biggest insight that I have had is that, you know, you'll probably have multiple different topics that you'll kind of be involved in any work setting today, and particularly in psychology. So, um, so the main thing is to learn the skills to be able to kind of say, okay, I can look at this and I have a sense of what the steps are that go about understanding something. So, generally, I say it takes 5 or 10 years to really make a difference in an area. It's very rare that it happens quickly. So, can you make that commitment? And if you make a commitment like that, you've got to really kind of care about something a lot, because there'll be a lot of hurdles that will come up, and you've got to stick with it to really make a dent into some of the significant social problems that we have. An example from our MECFS work is that we initially were told that MECFS was a relatively rare disorder and affected just white middle-class women, kind of the uppy flu disease. And when we kind of learned about that's how data was being interpreted from the CDC in the early 1990s, this was 30 years ago, we made a commitment to find out if that was the case. So we spent years trying to get funding. It took us a long time, and years trying to do a very famous community-based prevalence study. It's called epidemiology. And, we had a team together, and really we made a 10-year commitment. And our findings suggested that if you did the research right, rather than 20 or 30,000 people with this illness, it was probably over 1 million people. And so if you have estimates that are don't have like physician gatekeepers, just waiting for physicians to refer you, that's not a good way of doing research, because a lot of physicians don't believe this illness exists, and a lot of people don't have physicians. So you've got to do prevalence research by going directly to people and finding out if they're impaired with symptoms or not, and then have them worked up medically. So if you really want to make a difference in something, you've got to be committed. Same thing with the Oxford House Project. Before we were able to do our first kind of really intensive study, we had spent almost 8-9 years submitting grants, and they didn't get funded. And so we had to stick with it until we were able to be successful. So if you really care about something, you've got to stick with it long enough to make a difference. And that's the way. And even when you make that difference, you've got to recognize that it's really working with other community groups and organizations that you can take those findings and actually begin to bring about more second order change. You probably aren't going to be able to do it just yourself. You've got to work with coalitions and collaborators. And then it's got to be, again, recognizing that process is not a short-term one. It'll take a long time. So to stick with it, you got to find something you really care about that you'll be willing to stick with and become an expert in. So that's probably the insight that I didn't have early on, but certainly looking back over my career, that's something that has stuck with me.
Yeah, I think that's great. Definitely, if you want to kind of, especially with preventative change and making sure that the change will last like beyond yourself, it's not going to happen overnight. Just like recognizing that.
What would you like to do if you had something to stick with for a while? What do you think that would be for yourself?
I think for me, interests rely in just creating more mental health resources for underrepresented youth. So I've worked in the past with like the city's project, and then right now I'm working with another lab. They have the Act and Adapt program, and yeah, just making sure that this like underrepresented youth has like the mental health resources that they need, whether it's in school or at their home life, and just um minimizing those like cultural stigmas around mental health as well.
Yeah, and today the mental health issues are so prominent in terms of what's occurred with the pandemic and some of the racial issues. So certainly that's a topic you could spend a career on without any
Yeah.
problem. Yeah.
Yeah. And I think for myself, coming from a Latino background and just like knowing Spanish and being able to be that person that's kind of always that's able to translate and is able to like instead of having a translator come in, I can actually be the one that understands and is that like facilitator in there. Yeah.
Yeah, no, that's being bilingual is a tremendous strength that you have to bring to helping us understand social issues. Yeah.
Yeah. Yeah. Well, thank you. And I guess what is the biggest challenge that the industry faces right now that you would say?
So I think the biggest challenge for people who want to become community psychologists is that it's not unusual for people to set their sights on some very lofty goals. Um, so, an example is someone saying, I'm going to eliminate poverty. And while that might be something that's laudable, and we applaud that if that could occur, um, often, sometimes those goals are very hard to achieve. And the reality is, it's not going to be able to be achieved by certainly one person. So I think the lack of appreciation for kind of how one goes to go about doing that, I think is the biggest issue, because I think a lot of folks try something, doesn't work. They try something else, it doesn't work, and they give up and they go on to something else that's easier to do and maybe more well paying, and it's them a lot more security, which is, again, if you're going to be an adventurer, adventuresome researcher, adventuresome change agent, you have to recognize that a lot of the things that you try are going to be limited in their success initially. If you think about Thomas Edison and trying to get the first light bulb, he had to try thousands of different kind of fibers to find out what burned right. And that's really the same way in community psychology. I think having kind of sometimes very practical small wins on the course will help energize one to basically stay committed to that long haul. Having, in a sense, community partners, having the research skills to look at problems from multiple perspectives, particularly ones that are more dynamic rather than just linear, I think all prepare a social change agent to be able to study problems, to theoretically realize what it takes to solve them, and then also to stay committed to basically working on it. And I think that is the biggest challenge, because it's very easy to give up if one doesn't have, I think, some of these things, as well as the support um, to kind of continue on with the endeavor.
Yeah, well, no, definitely. Is there anything else you think you would like to add?
The only other thing that I would say is that, we are living in kind of a a very difficult time as we're coming out of this pandemic. So I think we have to kind of practice good self-help, self-health kind of issues ourselves, and keep our own stamina up, so that anything we can do that kind of helps kind of bolster our resilience is a good thing. So practicing self-care and taking care of oneself is often something that we should not forget. You can only be a change agent, a warrior for kind of bringing about change in the status quo if you have, taken care of yourself as well.
Yeah, Dr. Glansmith always likes to remind us that we can't fill from an empty cup. And she's always kind of asking us weekly, like, what did you do to take care of yourself? So I think that's great. Yeah. Yeah, well, thank you so much for doing this interview with me. I definitely got to learn more about what you do and what community psychology means to you. And I think that it's great to hear how different people got to this path, because I think it's interesting how kind of everyone takes a different pathway to get to where they are, and they're all very unique and they're all very valid as well. So thank you.
And thank you for asking me to be part of this conversation. And I've enjoyed learning more about yourself too. And I hope that this next quarter and next year goes very well. And I'll look forward to having more opportunities to interact with you during your stay at DePaul.
Yes, thank you so much. Likewise.
Okay, bye-bye now.
Thank you. Have a good one.
You too.